Okay, we'll start now. So thank you all again for attending our webinar. I'm your host, Professor Sandra Creamer. I'm a Waanyi Kalkadoon, and I'm the CEO of the Australian Women's Health Alliance. I'm here with my co-host, Associate Professor Nina Lansbury, a non-Indigenous ally who I've worked closely with over many years from the School of Public Health at the University of Queensland. I want to start by acknowledging the country which I'm joining you on, which is on Darumba country in central Queensland. I pay my respects to my elders, past and present and emerging. I recognise those many generations who have come before us and have been my teachers and carers and guides in my life. I'd like to acknowledge the Queensland Mental Health Commission for supporting and sponsoring this program as well. We've been delighted with so many registrations for today's event. Our motivation for this series is to bring the human face to a story of our health. We hope to translate key research to put the power of decision-making into the hands of women carers, of women and peoples who have joined us, and also all of those who are working. We will do this with a yarning style so that each webinar episode has a relaxed and inclusive approach. I'd also like to acknowledge and acknowledge that it's Queensland Mental Health Week, and that's one of the main reasons we're doing this. But I'd also like to acknowledge that tomorrow is World Mental Health Day, and it's an important conversation that we're having with you. So that we bring with us today today's focus and our excellent guests, which are focused on women's mental health and wellbeing. Given this, we want to discuss the range of challenges that women face with themselves, within their families or within their homes or communities with mental health, but focus on the pathways to achieving and maintaining mental health. Today's webinar will explore a range of mental health stressors, including impacts from climate change, including the 2000 flooding and cyclone events in Queensland, and ongoing aspects for women's families, communities, and especially to our Torres Strait Island women who we know who are joining us from some of our remote communities around Australia. Our speakers include Tanja Hirvonen, a Jaru and Bunuba woman, and a clinical psychologist and a mid-career researcher with expertise in mental health, social and emotional wellbeing, suicide prevention, and working with peoples impacted by trauma. And Associate Professor Fiona Charlson, who will also join us, whose research takes particular focus on the impact of climate change on vulnerable and conflict-affected populations. I'm going to share some stories and thoughts of my own lived experience. After we've heard each of our speakers, we will have an answer and questions, and you can post in the Q&A on your screen. Nina will manage this section and then provide a close summary of what we have shared. This can be a triggering or sensitive conversation for someone. So we've posted in our chat numbers that you can call at the beginning, and we'll also post at the end of our conversation. So today we've got joining with us Tanja, who is a proud woman, Indigenous woman, as I said, who's born and raised on the land of the Kalkadoon people in Mount Isa. Tanja is a clinical psychologist and career research with expertise in mental health, social and emotional wellbeing, suicide prevention, and working with peoples impacted by trauma. Tanja will bring today a combination of academic research, cooperative expertise, and clinical experience working with remote, rural, and urban communities, as well as Indigenous and Aboriginal Torres Strait Islander peoples' ways of knowing and being and doing her role at the Black Dog Institute. So Tanja, I'll hand it over to you, and thank you very much.
Thank you. So just a nod that you can hear me. Excellent. Okay. Thank you for that beautiful introduction and acknowledgement, Aunty Sandra, and also thank you to the Queensland Mental Health Commission for sponsoring this event and for our peers and allies that work alongside us in the work they do. So thank you. So this is, oh goodness, where do I even begin? I guess I will start from talking about the role that women play and how women can carry a lot in our roles. And women carry many hats. So as First Nations, so many women carry many roles, but First Nations women carry even more. So bear with me while I share that story. So the emotional load that women hold in most cases are the heart and the backbone of families and communities. And they carry the emotional, cultural, and practical weight of care. So these are these caring roles, heart-based roles, and emotional roles. So I guess so again, thank you so much for the introduction. I think working clinically for more than a decade, um, you see these you see amazing men and women in community, and I'm going to absolutely talk about the women in these communities. When things happen within communities, such as loss in a family or a caring role or a responsibility role, you see a large component of that care being taken up by women. And again, I'm not here to talk about the disadvantage and the things that we see on community because we live and breathe it every day. But we do have high numbers of suicide. We do have high numbers of chronic health, and we do have, I don't know, just the racism within all sectors and spaces within some of the work we see, like education or justice. And it's usually falling to women to hold families together or hold care together. Even after raising children, women also become caregivers again. So caring for aging parents or aging aunties and uncles or extended family members. And it's almost like a continuing cycle of care, and if any of my family on the Zoom today, we say sometimes like who in our family has a carer. We say, oh, that person's the carer, because we know that person will actually take on that caring role. So there's actually no time to fall over. So women need to keep going. So getting up to take the kids to school, cooking, cleaning, supporting others, and sometimes even just being that ear for someone to listen to. So doing all of this for others and for community and for families, but then navigating these challenges themselves. This is compounded further when you're First Nations and you've got multiple extended family networks and multiple networks of the professional relationships as well, because you're not inoculated from these yarns if you hold a job. In fact, when you hold a job, you're most likely also supporting other peers in your workplace. And look, when there's grief or something traumatic that's happened in community, the women hold the space for everyone else, managing sorry business, helping support funerals, helping to get catering, or who's going to cook what's the presentation going to look like, making sure the children are still fed. Sometimes in a community or a funeral or a gathering, there's one house or two houses that are looking after the children. There's a couple of houses that are looking after the food, and that usually falls on women. Again, caring roles for parents, and it's an expectation or it's an obligation. So you're torn between, working and making sure we're looking after our little families, but also the extended family. I see it, I've seen it. And I guess going back to the clinical work that I've been doing, I've worked in Aboriginal community controlled sector for a very, very long time. And most of the stuff that, when I work with Aboriginal women, it's usually around burnout or just being overwhelmed or tired and fatigued from holding all these roles all of the time. Do you think, oh goodness, is this just this person's view? My view? No. Research is actually backing this up. So valuing Indigenous women's unpaid labour, there was some work done by the Australian National University, so ANU and UQ, University of Queensland, back in 2024, where they investigated or they looked at Indigenous women. Do they do more unpaid care work than any other group? The estimated economic value, just so that people are aware, can be up to 200 to 500 or say 470 a day of extra labour that an Aboriginal woman may carry out as part of their role, which is equivalent to 81,000 to 190,000 a year if we're going to put another dollar figure on that. Yeah, that labor just remains, I wouldn't say undervalued, but it just remains an invisible role, another hat that women carry and wear. But important for whoever's on the screen to realize that when you are employing or you have Aboriginal women within your organization, what does that look like, and how do we support Aboriginal and Torres Strait Islander people generally, but also people that hold positions within their communities and within their families. So again, talking to that earlier, women can be exceptionally vulnerable to burnout fatigue and compassion fatigue. Um, Almost it's normalized to be dealing with one concern and then moving on to a next concern. Let's put that to the side for a minute and we look at what's happening nationally, but also internationally with the increase or the increase on conversations and instances of racism. So as women, we get to see, well, we're observing and witnessing racism that are impacting family members, and again, heartfelt roles, feeling that through our heart in every fibre of our being when we have family members imprisoned or incarcerated, family members struggling to put food on the table because of the cost of what's happening financially, racism within the workplace. Like there's report after report. I think I just opened up my computer the other day and there was another report on racism in the health care sector. I'm like, yeah, we know it. So what are we going to do about it? So again, as women in the workforce or women at home, seeing that, observing it, supporting family, navigating these systems of harm. And then we also have families that might be impacted by alcohol and other drug issues. We all have members in our family who might be struggling with addiction and substances. Aboriginal women holding space for those family members. So we've got things like intergenerational trauma, grief and loss, systemic racism, and all of these factors that actually can have such a big impact on these beautiful, strong Black women. And again, I'm not taking it away. I know that Professor Fiona will talk about this further, and same with Sandra. But we will talk also about not just the politics, not just what's happening systemically, but also then what's happening in our environment with the climate and all of those other factors. So again, just moving back to women and what they have to hold and share and bear witness to, it's substantial. So it's no wonder women feel that burnout. Okay, so when they have burnout, we're going to go along and try and access some wellbeing supports or mental health supports. I just want to pause there for a minute because after the pandemic, then we had the referendum. Just talking as a fellow psychologist, we saw wait times from 3 to 6 months to see a mainstream mental health person or psychologist, and even longer to see an Aboriginal and Torres Strait Islander psychologist. There's only up to about 350 in Australia. I can only just talk about psychologists for a minute. We need another 1,000 to improve the disparity between Aboriginal and non-Aboriginal psychologists. So we're also looking at, when you do seek supports, what supports are there available that are culturally safe and supportive for you when you're putting out your hand or you're trying to access supports and help. So, which is worrying. That's worrying. So a big piece, again, another hat I wear is with the Australian Indigenous Psychologists Association. We're trying to grow our own. But I probably won't see it in my lifetime, that 1,000 number increase. So we also support non-Aboriginal psychologists who work with our mob, so they work in a culturally safe manner. And, making sure that, women need different things. So I just want to also talk about, and I didn't do this at the beginning, but the strength and resilience of Aboriginal and Torres Strait Islander women being here for more than 50,000 years, 60,000 years, and so on. We talk about intergenerational trauma, but I also want to talk about intergenerational strength, the beautiful wisdom and the value that we have for Aboriginal and Torres Strait Islander women's knowledges and the ways that they care with heart. That's the foundations and the strength and the resilience that they do bring. So So seeing an Aboriginal woman have these issues around, the compounded trauma, compounded caring, and then needing to seek supports and making sure that they get the supports that they can actually get, it's very, very important for the work that I do or try and engage in. So again, people on the screen that actually have influence in the workplace, just ensuring that there are wellbeing supports being embedded for all of the people in the workforce, but knowing the nuances for certain populations within the workforce. And recognizing that there are responsibilities and cultural responsibilities that certain people within your organization may have to carry and practice as part of their role, not only in the workplace, but in the community. Building, knowing all of this, then making sure that in the workplace or any other sector, that we are managing racism and any other burden that might actually creep into the workplace or whatever sector that you might be in. And just for the beautiful women that might be on the screen, knowing that this world is difficult, is beautiful, but at the same time can be quite difficult, having intentional well-being, like making getting to a place where we're not feeling the guilt to have time away to look after ourselves and sustain our, have maintenance for our self-care or maintain health and well-being for ourselves, for us first, but also for our little families and then our communities. So what is needed to support Aboriginal and Torres Strait Islander women? So I would say culturally safe, healthy, harm-free wellbeing mental health services, recognition of this care that these beautiful women carry out each day, policies that reflect Aboriginal and Torres Strait Islander concepts of care, and intentional wellbeing structures within workplace or for women on the screen, intentional wellbeing practices that you carry out every day as part of keeping yourself well. And I think access for us to come together for collective, collective healing or recovery or, I don't know, regathering. So coming together, like it doesn't have to be done on our own. In fact, we heal more when we're with each other. So no longer also seeing well-being as optional, seeing it as part of everyday life and everyday practice, no matter where we are, so that we can give the best of ourselves to ourselves, and then to our families and our communities. And if we do engage in work, that we try and engage in work that is purposeful, and going towards that greater cause. I am just checking if there's any timekeepers here. If I am probably closer
couple more minutes, Tanja, and then we'll move on to the next speaker.
Excellent. So wanting to talk about that optional add-on or something that's actually, inbuilt. So it's something that I've learned along the years that when we do see Aboriginal women, for well-being, there's often a guilt. There's often a guilt in actually even coming in to have a yarn about it, because it's just, you should just get on with it, right? For me, if there's another message that I would love to leave with everyone that's on the screen, is that we have self-care in the middle, which is, and then we have selfless, which means we give our last feed, a last shirt off the back, a last $5. And selfless, which means you give everything you've got to somebody else that might need it. And then you've got selfish, which is, now everything that is out there is mine and mine only. But wanting for us to find that middle piece, that sweet spot in the middle, where we can give, but we make sure that we still look after ourselves. So it's a sweet spot in the middle. There might be times where we do give much more of ourselves than that's necessary, but then pulling back and making sure that we still have something for ourselves. And there might be time when we might have to do a 50, 60, 70-hour week, and we might feel that we have to do this work or this piece of job, or we have to go and look after this particular family member at the expense of everything else that I have in my life. I wouldn't even call that selfish, but I mean, you're putting everything into one basket. But then coming back and making sure that we are, one, looking after others, but also at the same time, in the same hand, looking after ourselves. I'll share something that my grandmother, I've lost my grandmother, my beautiful grandmother, Granny Maisie, she shared with me, because, you know, sometimes as women, we may get asked a lot. We might get 5 phone calls before 9 o'clock about something, asking for something. So my grandmother gave me this beautiful bit of advice, which will also help find that sweet spot. You can only give what you can give. So if you've got an hour of time and someone asks you for 3 hours, you can just say, I love you, but here's my 1 hour of time. If someone hits you up for $50, but you've only got 30 and you feel comfortable giving 30, you give the 30 and say, that's all I have. You know, when I'm putting it in monetary terms only just to help with the understanding, but you can only give with what you've got. And that's really held me safe. And coming from a beautiful woman that probably gave so much more of herself than many people that I know, it's certainly held me well with many requests that we do get. Thank you.
Yeah, thank you very much, Tanja, for that, and I appreciate your words of wisdom. So I'm going to talk, and what I'm going to talk about is about my own lived experience. And I just want to, you know, raise that issue because I think it's really important about us as a person. And we know that there are many people going through mental health issues, depression and everything. So in our lives, some of us can go through issues that affect us deeply. It can be grief, trauma, depression, climate change within our own environment or where we live. And we must remember all of those who are in drought, flooding, and the effects that it's had on them. And these are some of those things and times that it can be the loneliest walk for some people. And we know mental health. What does it mean? It means impact thinking processes. And this is a protection under the Disability Act 1992. I'm not an expert on this, but you must seek expert help first and foremost. And I'm speaking on life experiences. There are so many issues that relate to mental health in our lives. Remember, mental health is affecting our youth as well, men and elderly as well. Be mindful, some people are fragile when we are having a conversation. Mental health mental health impacts our thinking process. For me, I've been through that, but to walk is not easy. We look okay, we sound okay. We know within ourselves we are not feeling okay. Sometimes it can be hard to think or even get out of bed. It can be a long walk, a long journey, and it can be lonely. But as Tanja said in her conversation, it's important that we seek help. And I encourage everyone to seek professional help if you know anyone going through mental health. Also, we must have true conversations with people. If we know they're going through any mental health issues, and if you're supporting someone with mental health, you must also have a true conversation with yourself and how you're supporting someone. Sometimes some people might find just talking to someone is the best medicine. Someone who is going to take that time to listen. It is listening that is most important and providing people with the different options they can take. For example, professional help, helplines, or whatever they need. And I'll give you an example of my own life as well as having my own doctor. I had 4 dear friends who I could call on them day and night. And it doesn't matter, you know, what time it was. I could just pick up the phone and they could talk to me for hours. They would just listen to me for hours. Again, I recommend a good doctor and showing care, and also really show that person that you care for them when they need you, and making sure that you're not a burden on them. It's okay to take a meal around to people. Check in and asking people, are you okay? And making sure again that you are not making them look like they're a problem or they're a burden. And that's what happened to me. People made sure that I was not a problem or that I'm not a burden. But also, if you're going through mental health or if you're dealing with someone with mental health, make sure there's boundaries around yourself or around them and how much that you can handle someone who is mental health, that, you know, they're not calling you every 5 minutes, or someone who has mental health and is trying to get up every day. You know, put those boundaries around to protect yourself if you're not going okay. Take one day at a time. Take one step at a time. It's very important. One thing I find is that, and I was having a conversation with someone this morning, you know, there's far too many texters. There are not enough people to talk to people. You know, people text, oh, are you going okay? Oh, yeah, that's okay to remember, and it's nice, but it's okay to have a conversation. There are a lot of young people out there who we know sit on the internet. There are a lot of older people. There are a lot of people who sit on the internet and thinking, oh, okay, this is what I'm going to do. This is going to be able to support me or do that. No, we need to have the human face. We need to have that human love. We need to have somebody that we can talk to and that someone can be there with us. Don't just rely on sitting in front of an internet or sitting in front of a phone. That's the way to deal with mental health, or that's the way that, you know, encouraging people to go on and Google things. No. But remember, don't sit in silence with your own mind, because as I said, mental health means it impacts our thinking process. Ensure in your workplace or spaces that it's a supporting space. Speak to your boss confidentially. Let them know your situation. And if it's long-term, let them know. If it's short-term, you know, let them know as well. Look at the support that can be put in place for you when you're in a working space, because everybody knows now there's somebody going through something in a workspace, and there are different policies and processes that are in place, and discuss those and review policies and procedures for mental health. What is right for someone who's going through mental health? We know there's policies for women that have just taken place through domestic violence, and there have been changes to support women who are going through domestic violence in the workplace. And there are policies that we need to look at. How can we do that? And as I stated before, you know, under the Disability Discrimination Act, we do have a protection, and it's important. I highly recommend people to go and have a look at that legislation and that act. And what is your own wellbeing practices when you're going back to work or when you're going out or doing something? And what are you doing if you are caring for someone? You know, put in that practice for yourselves. And again, I really want to stress the importance of mental health within our young people, and to recognise the different behaviours and changes in our young people. We know we currently have a high rate of suicides among young people when it comes to bullying, and you know, we know that there's a lot of grief and trauma for young people when they go to school. Ensure that they have help. Ask them, you know, what is wrong with them. Take that time out. If you see that different behaviour, it's important to really talk to people to help them address what they can do. Give them those options. It's so important. I cannot stress enough how important it is. Again, I'm talking about my own lived experience, about how people have helped me put things in place, how people have encouraged me. You know, there are times when I didn't want to go out the house. You know, my beautiful neighbours left meals behind for me and everything like that. I have a beautiful family who have given me such support, but also workplace where they could support me. They knew my limitation of how much I could work. You can always ask if you can work part-time. Ensure that, you know, because you don't want to even burden yourself even more so by not being in a financial situation where you're going to throw your job in and say, well, you know, I can't handle this. I'm working full time and this is not what I want. But, you know, you got to look at you've got to talk to somebody and say, okay, this is not what I want. I can't handle working 5 days a week, but I can handle working 3 days a week, maybe 5 hours, you know, 4 to 3 hours a day. Talk to somebody. Don't throw everything away and thinking that this is the end, that, you know, I can't have that discussion. Nobody wants to listen to me. Nobody wants to help me or anything. There are always people out there, you know, to help support us. We know that there is, you know, when you're teaching young people about the 5 people, you know, the 5 fingers on people who you can go to for help as a child or within your school principals or all of these. As adults, that still is important for us. Have those people that you can talk to, have a doctor, have your professional help people, and really make sure that you are looking at yourself, okay, what you can handle, and be sure to have that conversation, because I can tell you, mental health can be long-term. you know, I don't have to tell anybody my story. You just need to go and Google everything, and it's all on the internet. But you know, I'm here to try and help people understand that, you know, you can address those issues. And if you have people who you are supporting, help them address those issues. It's important because, you know, I want to say that we've got to understand that every lives matter, that people matter when they're going through mental health, and that, again, if you are supporting someone in mental health with a mental health issue, understand the boundaries that you must put in place for yourself, because that's important, because you don't want to end up having a breakdown because you're helping someone with a mental health issue. And again, like I said, I cannot express enough that I'm not an expert, but you must seek mental health and professional advice. Again, look at the policies and procedures in the workplace. And if, you know, we do have some men here online who have contacted me and said, you know, nobody's discussing mental health. We want to hear, you know, things as well. And, you know, to those men who are on here, you know, have a look at things that are in place. Have a look at, go through, if you're in a workplace, go through all the helplines, you know, that's for men, women, anybody here. Go through and give people a list. You take that time out and say, okay, I'm going to share this information with you. Do a list up and give that to someone. If they know that they can ring someone, even if they pick up a phone and can ring someone for 5 minutes. But I can tell you now, if you see someone who's on the verge of having a massive mental health breakdown or anything, don't sit there talking to them. Let them talk to you. And one of the most important things that we can say to somebody, and I'm a firm believer of this, is when someone's going through something, ask them, are you okay? Are you okay? I cannot express that enough when we're dealing with people in mental health. Are you okay? If it's in your workspace, are you okay? If it's out to school and you see a child, your own child being bullied or something's happening, or they come home and their behaviour's different, and they ask them, are you okay? If it's your friend or your neighbour or someone within your family, ask them, are you okay? Sit down with each and every one of them and look at where the options are, where they can get professional help, what they can do, and make sure that you keep checking in on them. Are you okay? Take that time. Again, like I said, every life matters, and we must understand what mental health means, which is under the Disability Discrimination Act. Impact thinking process. That's what mental health means. Everyone has a right to go to work. Everyone has a right to seek medical help. Everyone has a right to just be okay in a space that they are in to seek help. So thank you all very much. I cannot express how important this conversation is for me today. And I hope that someone out there, whoever's listening, that you can help somebody and understand that mental health affects us all, and we can't be denying it. I think, you know, that's the problem too. Some people deny that there is an issue with somebody in their own family, in their workplace, and you know, they just ignore it. No, every lives matter. So thank you all very much. And now I'd like to go on to our next speaker, who is, and welcome our final speaker, Associate Professor Fiona Charlson from the University of Queensland, whose research takes a particular focus on the impact of climate change on vulnerable and conflicted affected populations. So welcome, Fiona, and we know also that your work is internationally recognised for your expertise in mental health, with a particular focus, as we said, on climate change. And your research explores the psychological effect of environmental change, including climate anxiety and resilience. And you've been a lead in some major initiatives, including the Connecting Climate Minds project with Wellcome Trust, and also the ARC Discovery project, examining how families respond to climate anxiety. So thank you, Fiona, for taking the time and coming on. Thank you.
Thank you, Sandra. And it's when I was invited to join you all today, I was very honoured and very excited. And honestly, it's a real privilege to be here amongst such amazing women. And Sandra, I want to thank you for so generously sharing your lived experience, which is exactly why we're here. So thank you so much. As you mentioned, I'm going to speak about the intersection of climate change and mental health, and specifically women's mental health. This is an area that I dedicate my professional life to, but it's also deeply personal. Yeah, I want to sort of try and unpack what we know about this, and perhaps talk about a little bit and about why these impacts are gendered, and talk a little bit about how we can respond, not just with concern, but with compassion and policy and leadership. I want to acknowledge up front that my views that I'm sharing are drawn from the published literature, and this is still very much an emerging field, and there are big gaps in our understanding and particularly our perspectives from lived experience and First Nations people. So I just want to acknowledge that up front, and I do apologise if you sort of perhaps feel like the perspective being shared is not representative of your own experience. Yeah, I am sharing from what limited literature we have. It's a fast-moving field, but it's still very new. So I'll just start by saying that climate change, as we all know very well now from the science, it's leading to the increasing frequency and magnitude of extreme weather events, such as drought, flood, fires, and also rising sea levels, which is of a huge significance for many communities in Australia, but also in our region more broadly. Climate change is also displacing people. People are being forced from their homes, either temporarily, but more and more so, they're being displaced permanently and having to migrate. And this is also having impacts on things such as loss of livelihood. So it's really, climate change can really be thought of as an amplifier of existing inequities, disadvantage. If there was an inequity existing before climate change, you can pretty much guarantee that it's going to be amplified as we see the climate crisis progress. In terms of the psychological impacts, they're really wide-ranging and often invisible. So something that might be perhaps most visible, at least in terms of media and, you know, the discourse around climate change and mental health, there's something called eco-anxiety or climate anxiety, which is really this kind of existential fear of impending doom. I guess the most or the first real expression that I saw of this was during the school strikes, climate strikes, which really took off a few years ago, pre-COVID. And we tend to think of this being mostly impacting young people, but there's also research showing that it disproportionately impacts women compared to men. Then we have these sort of more direct impacts from climate change, such as trauma, PTSD, depression, anxiety. Can be directly related to hazards that are associated with climate change. The other thing to note is that what we're seeing with climate change is communities being impacted differently in terms of disasters compared to what they were previously. So it's not uncommon. We have a long history in Australia of natural disasters, so bushfires, floods. This is not new. But what is new is that they're now rolling events, sometimes happening at the same time. So we can have a bushfire and a drought quickly happening at the same time, very quickly followed by a flood. So they're sort of compounding, and communities are not getting this break to sort of go through that recovery process. The one way that mental health is being impacted by climate change is by the real disruption to social and economic factors. So it's creating food insecurity. It's leading to interrupted access to healthcare, and therefore interrupted employment. It's really quite wide-ranging, and of course all these social and economic determinants are very well long established, linked to negative mental health outcomes. So what about gender? There is research emerging quite strongly that women are being impacted differently and disproportionately compared to men by climate change. And this is due to a combination of social, economic and cultural factors. So as I mentioned before, climate anxiety or eco-anxiety has been shown to be more prevalent among women. We're more anxious about our future. We're more anxious about the future of our planet, of our children, etc. There's also literature from some low-income countries, and particularly rural settings, where women are more likely to be exposed to these climate-related disruptions, such as floods, droughts, insecurity, and displacement. And they're not just, and these events are not just physical threats, there's psychological stresses that lead to anxiety and depression and trauma. So women are increasingly exposed to these disruptions. A quantitative study of about 600 women in rural Pakistan has found that high levels of stress and anxiety and depression have been linked to climate stresses. And in this particular study, it was interesting because they found that social support and some cultural norms were kind of the key mitigating factors that could sort of determine whether someone did better or worse with their mental health. There's also another study that came from a flood-prone area in Bangladesh that showed that adolescent girls suffer higher rates of psychological distress than boys. And in Australia, there's some evidence that women are experiencing rising rates of mental disorders linked to heat waves. So there is definitely a gendered difference here. We don't really understand why, but we can make some fairly I would say safe assumptions, which links strongly back to what has already been said today. Women are often the primary caregivers for children, for elders, those with disabilities, the community. And, as the climate crisis intensifies, who's there to support us? So we manage the evacuations. We might be managing securing food and water. We're providing emotional support. We'll be manning the community centres where support is being provided. We'll be cooking the meals for our neighbours. And this invisible emotional labour really does lead to burnout and stress. There's also evidence of that climate-induced displacement increases the risk of gender-based violence. We also know the event of a climate-induced disaster. There's a spike in gender-based violence. And women and girls face a heightened risk of that. And that can really kind of leave some deep psychological scars as well. The other thing is barriers to mental health support. So we know in many areas that access to mental health services remains limited, and particularly for women. And some of the factors noted are cultural stigma, financial dependence, a lack of mobility that prevent many women from seeking help. There's also the issue of intersectionality. So climate change doesn't affect all women equally, and there's some intersectional factors that we can consider and that influence this relationship, such as age, race, disability, sexual orientation, and that shapes how the woman's experience to climate change. For example, transgender and non-binary individuals often face discrimination in disaster response systems, and Indigenous women may experience compounded trauma due to historical and systemic exclusions. So despite these challenges that I've just sort of laid out and sort of dumped on us all, we possess enormous strength and resilience, and we will continue to be a source of strength and resilience. We're healers, we're leaders, and we're change makers. And across the globe, women are really leading a lot of sustainability initiatives, advocating for climate justice, and we're really building networks of care. And I think, I just want to sort of hark back to something that really Tanja and Sandra both touched on, which is about this collective experience. So unlike mental illness on its own, which can be a very isolating and individual experience, the impacts of climate change are very much a collective experience. It's quite different. I think the experience is quite different. And that's a real, I think, source of optimism for me, is that despite the challenges and what we are faced with, collectively, we will come together and we will find solutions and we will find support for each other.
Yeah, thanks, Fiona.
Yeah, that was beautiful, Fiona. And my
Thank
name's
you.
Nina Lansbury, and I'll just try and facilitate a few in our remaining time, some of the questions that have come through. So thank you so much to those who've posted, and thanks to our amazing speakers who are always great to hear. I've heard them several times and I'm always learning something new. So Tanja, we'll go to you first. There've been a few questions. Your focus on care for First Nations women in particular has really stimulated quite a few questions on the chat. Thinking about tools and resources. So I did put, a list of organisations, of course, with helplines and websites, but how to use these tools is a question. And then there's also an associated questions, particularly for First Nations women, around sorry business and about the needs of the family and the care for those affected. If you could speak to that, that'd be great.
Thank you. We should put a list. So we put some lists of phone numbers of places that you can reach out for help, but the tools and resources are more extensive. So I wonder if I can send a list of reputable resources that we can share with everyone that's joined the sessions. Is that comfortable for people? Because there has been, because it's been such a big issue, there has been a lot of work done by some deadly, beautiful people working in the space and led by my mom. So, but I'll just take a couple of minutes to put that together. But there are some for sure. So for community and also for the workforce. So hopefully that answers that question. But the other question was around collective healing. And sometimes so just talking about grief, we're going to see, just want to answer that question. Sometimes we see families in height of grief turn to maladaptive ways or unhelpful ways to heal with grief and trauma. And that's with most families. So we will get to see sometimes some of our families at their worst. I'm not trying to use this out of a reason or an act, that it's okay or to justify. It's just part of what happens. But it is a symptom certainly of intergenerational trauma and not having the skills and the resources and the abilities to heal in a healthy way. Let's just talk about that healing in a healthy way. Like, it's some of the things that we've had to deal with are unfathomable, like losing some, I've got an aunt in the Kimberley. I remember one year she said she went to 16 funerals in 1 year. I mean, how do you compartmentalize and get on with life with that? Some of our people that we see dealing with so many different issues. So one, it's hard to have the recovery and the healing. But two, there will be people that will go into maladaptive ways. But what I have seen work, and I'm again really talking about this quite broadly, is making sure that they're going on Auntie Sandra's point, like boundaries, having strong cultural authority when handling gatherings and having times of togetherness. I have seen someone bring in someone that's outside the family, that the whole family trusts, to have yarns with the family about how best to navigate. And look, we've seen this, and we've probably even been engaged in it. Having a respected elder come in to support some of the yarns about how do we move on, where are we able to have the funeral, who is able to be the pallbearers, how do we make sure that we have the wake, all of those sorts of things. And I'm talking about a particular, a funeral, respecting when we've lost someone, but usually it's those times that we actually see those heightened emotions, and we are all probably not being the person we are because of the loss of the significant person. So yeah, hopefully that helps a little bit, but I'm happy to take that one offline as well, because it's context driven. Sometimes the answers might be a combination of efforts for big issues.
Thanks so much, Tanja. And for all attendees, as you would have heard Sandra mention, we will be sending a follow-up email that will have both this recording, but also more resources, and including those ones that Tanya's referred to. Very quick question going your way, Fiona, is one of our attendees asked about the value of or how to access and the value of lived experience groups. I know you've spoken about climate affected women, and that's a subset of others dealing with mental health. But if you just wanted to respond.
Yeah, sorry, just clarify the question for me.
Yeah, that about seeking lived experience, and how do you find people with lived experience so you can have support groups?
Yes, okay. That's a good question, and other people might have thoughts on this. Look, it's there's not like a pool of people that you sort of look up in a directory. When you are, I mean, there's people, I guess it depends on what lived experience you're referring to in my field with respect to climate change and mental health. There'll be the best place to look is community. Impacted communities, and I mean, you could probably speak to almost anyone, but there'll be people there who have sort of, once you ask around, who sort of float to the top as names of people that could be engaged with. Maybe the person who asked the question can just maybe help me if.
No, that's okay. You're doing well.
No,
it's been rich. Oh, and Tanya's got her hand up too. Yeah, maybe just 1 minute, Tanja, and then we'll wrap up.
So this will be an announcement, but we have an Indigenous Australian Lived Experience Centre that has lived experience Aboriginal and Torres Strait Islander people from all around the nation. But sorry, just to answer Fiona's question, it's a particular field. So it's in lived experience and suicide prevention, postvention, and traumatic experiences. So because of the need, because of making sure that we are talking to the people that have been through an experience to help shape and reform what services are actually doing on the ground. So again, it's been headed up by CEO Vicky McKenna, and but there's going to be announcements and releases in due time, but we can send that out in an email.
That's very exciting. It's such an exciting week for new announcements, and you've come from the SNEAK conference this week, Tanja, where there's been a lot of discussion, including and beyond mental health. So I'm just going to quick wrap up, then passing back to Sandra. You've thank you also all for coming in, and I hope you, like me, have really valued these three incredible women. We've been speaking about women and mental health and managing it for health and wellbeing. Psychologist being Tanja, lawyer being Sandra, and a mental health researcher being Fiona. And if I just pull out the themes, look, mental health is a health issue. It's a chronic health issue. It could be a disability. You need to recognise the load. You don't need to be alone. Sandra's comments about it can be the loneliest walk, and to walk is not easy. But the size of the attendance today and the fact that we have a whole week in Queensland and a whole day globally means this is an issue many people are dealing with. It can be a gendered load, and as Fiona really articulated, not just gender, but intersectionality, gender and age and stage in life and financial resources all come into play. But then the more positive side is that you're not alone. Sandra shared very vulnerably her lived experience, and just about there are people around you to hold you there and hold that support. And then there are professional services, and we'll give you more follow-up there. And then the lovely words from Fiona about the power of women, that they are the centre. They carry so much. They carry that care even in a time of disaster. But they're also all of us would know ourselves or others around us who are so practical and so caring, even when you have to reach very deeply inside. So thank you so much, Sandra, if you want to just close up.
Yeah, thank you very much, Nina. Thank you, Fiona, and to Tanya. And as Tanya said, for all of those people who are on here, you will receive the tools that you need to look at, whether it's in your family, in your workplace. And I will express, we do have men on here, and we do have we do have community organisations who have registered to come on here, and you will receive that tools from Fiona and what you can do and help people, because it is the tools that we need to help. And, it's not just thinking, oh, okay, my lived experience, but we also need to have those different tools that will be to help you guide someone. So thank you very much, Tanya, for putting that together. And I hope our audience, all of you who have registered, will receive that. Again, thanks everybody to come on. So, I'm going to ask our two speakers a key message. And one of my key messages is that, remember, every life matters. You are not alone in this. Take time to listen to somebody who has mental health, and the tools that we will send to you, please use when you are working with somebody in mental health, that you in your workplace or within yourself or within your own family or communities. These resources that we will send out to you are from expert people, not just someone with lived experience, but from experts who do have those tools to help you, again, with somebody or within your own workplace or within yourself. Tanya, Fiona, I'll give it to you and a quick message, and then to you, Tanya.
Yeah, thanks, Sandra. So I guess just in summary, I just reiterate that climate change is having very far-reaching, wide-ranging impacts on mental health. But it's a collective experience, and I think there's a collective strength there among communities, and particularly amongst women. And yeah.
Yeah, thank you. Tanya, I'll give it to you.
Thank you. So the only thing I wanted to say was just please take some time out for yourselves to take care of yourselves and yeah, bring your best selves to whatever drives your purpose. Just hoping you're not feeling the guilt for doing that. So thank you. And thank you, Auntie Sandra, Nina and Fiona. It was a lovely yarn.
Yeah, so again, we will have on, there's 1-800, there's Lifeline, there's, look at Black Dog Institute, 12 Yarn. These are the services that you can ring. We'll have that posted on as well as in our tools. And we all hope you take care of yourself and your loved ones during Mental Health Week. So thank you all for coming on. Thank you. What a great team and conversation. Thank you very much.
Thank you, everyone.
Thanks, everyone.
Is it closed. That's it.